This video is on Paget's disease of bone, otherwise known as osteitis deformans. We will be studying it under all of these headings pertaining to Viva-West questions as well as entrance-based questions. Make sure to solve the MCQs at the end, comment them in the comment section below, subscribe to our channel for more such videos for in-depth analysis on health science topics. So getting right into Paget's disease, we are going to correlate it with a man called Bart. So as the first letter of his name suggests, Bart has a problem with his bones. Now, as complex as nature is, the 206 bones of our body are involved in continuous remodeling, right? So the bones of our body are continuously remodeling, but this process is abnormal and excessive, leading to enlarged, weak, and extremely vascularized bones in Bart. So remember, there is abnormal remodeling of the bone, which correlates to abnormal resorption and deposition. This can be remembered by the reminder of his name. So abnormal resorption and deposition. And this is a deformity in the bones. The exact etiology is still largely unknown, but several theories have been proposed to explain it. The most famous ones being in regard to genetic abnormality, inflammatory reaction to the bone, and slow viral infection, especially paramyxovirus. Paget's disease evolves through three phases, which are the lytic, the mixed lytic and blastic, and the sclerotic phase. So this corresponds to the lytic phase, which is the initial predominant osteolytic phase. So here there is excessive bone resorption. This is followed by the mixed phase, where there is lytic and blastic activity, right? So here there is excessive abnormal bone deposition. So here there is activity of osteoblasts. So this was lytic, this is blastic. This is followed by the sclerotic phase, which is the final phase resulting in weakened and distorted bones. I assure you, you'll understand this better as we progress into the lecture. Its clinical features: there is a prevalence above the age of 40 years. It is rarely seen below the age of 20 years. There is a slight male predilection, and geographically you see it in European countries such as England, France and Germany, and very rarely in Middle Eastern and African countries. In the presentation, a patient might be asymptomatic or he might be symptomatic. So in 1/5 of the cases, the patient is asymptomatic. And here it might be an incidental finding during a routine radiographic examination or the biochemical analysis of raised serum alkaline phosphatase levels. When the patient is symptomatic, the most common presenting complaint is deep aching bone pain. So here you have the symptoms of a dull pain. It is constant in nature and it is deep below the soft tissues, right? So the patient complains of dull, constant pain, which is deep. It's deep below the soft tissues. The involved bone, they appear warm because of the increased vascularity. Okay, in the histopathology, you will see that the marrow spaces, they're replaced by vascularized connective tissue, right? So there is a deep aching bone pain. The bone involved is warm. Apart from this, the other presenting complaint might be of a pathological fracture, non-specific headache, impaired hearing, and tinnitus. The involvement, it may be limited to one bone, which is monostotic, or multiple bones, which is polyostotic. The sites of predilection are the axial skeleton. Now see, the most common sites of involvement are the weight-bearing bones of the body. So what would these be? These would be the lower vertebrae. So here you have the lumbar vertebrae, the sacrum, then you have the pelvis. Apart from that, in the long bones, there is the femur, the tibia, which is involved, and the skull, right? Make sure to remember these 5 because these will form the basis for your the rest of your clinical features. So see, if there was involvement of legs, as the disease progresses, there is thickening, enlargement and weakening of the bones of the legs, giving rise to a bowing deformity, right? So in this, the person appears to have a monkey-like stance, right? So this is the bowing deformity. Apart from that, there's a waddling gait. When involving the skull, you see a progressive increase in the circumference of the head, as well as in the older times, a clinical symptom would be, a sign would be an increase in the head size because of the increasing head circumference. A very important point here is nerve compression. So because of the distorted bone structure, the foramina of the skull, they get compressed. So this leads to nerve compression, and the complications of these are varying, such as deafness and visual impairment. You also see platysbia, which is softened bones at the base of skull descent. When involving the spine and the pelvis, naturally the most common complaint would be back, neck and hip pain. There would be tingling and numbness in the arm and leg involved, bladder and bowel incontinence, severe headache, dizziness, syncope, dementia, etc. Because again, the foramina of those areas, they are reduced in size, leading to nerve compression. Now, in the skull, there is another important thing relevant to the jaws and the oral findings, right? So, in about 17% of the cases in Paget's disease, there is jaw involvement, particularly in the maxillary bone. Here you see a progressive enlargement and widening of alveolar ridges, flattening of palate and spacing, right? So, look at this diagram carefully. What is the first thing you see? If this is the right side of the patient, you see that the alveolar ridge, right? This is the alveolar ridge. On the right side is enlarged, right? It is widened and enlarged. The overall maxilla is enlarged. There's flattening of the palate, and if there were teeth present, you would notice spacing. You would see migration and loosening of those involved teeth. In extreme cases, what can happen is the middle third of the face, especially, it can grow to such grotesque proportion that it can give you a lion-like facial deformity, right? So this is called leontiasis osseous. So leon indicating a lion-like facial deformity. Again, a presenting complaint might be denture tightness because of the growing jaw size and the alveolar ridge size. So radiographically, again recalling the three phases, here you had the lytic, the mixed lytic and blastic, and the sclerotic phase. So in the lytic phase, the most prominent feature is osteoporosis circumscripta. So in the initial lytic phase, because of excessive active bone resorption, you see well-defined radiolucency, particularly in the frontal bone. Following this is the mixed phase. So here there is abnormal bone deposition. This is indicated by cortical thickening, changes in the inner surface of the outer table of the skull, as well as something called the cotton wool appearance, right? Cotton wool appearance indicates a sclerotic lesion surrounded by areas of demineralization, right? So you see them in the skull. Apart from that, ultimately there is diffuse sclerosis entering the inactive stage. In the intraoral periapical radiograph, when you take a radiograph of individual teeth, what you notice is generalized hypercementosis, right? So you would notice generalized hypercementosis, and this is very important in relevance to extraction of teeth. Histopathologically, again, remember the three phases, which are lytic, mixed lytic and blastic, and the final is sclerotic. So in the lytic phase, you have excessive disordered areas of resorption, and the cells involved in resorption are the osteoclasts. There are large number of osteoclasts with up to 100 nuclei, right? So here you can notice them. Let me show you a diagram. This is a diagram I've drawn, and in this area, right, in regard to the bone, you can see that these osteoclasts, they have a lot of nuclei, and they are resorbing the bone at one end. Following this is the osteoblastic phase. So here there is haphazard laying of new bone matrix and formation of woven bone without regard to the patterns of stress, right? So what we are trying to say is there is abnormal bone formation leading to compact and dense bone. This is called the Pagetic bone. This bone is coarse and fibrous. The marrow spaces, they are filled with highly vascularized connective tissue. Remember, So this is why the area over that particular bone would appear warmer because of replacement of the marrow spaces by vascularized connective tissue. There is also something where the pagetic bone does not have a tendency to form Haversian system or center on blood vessels, right? So this is actually a diagram of mixed lytic plus blastic phase. At one end you have this lytic activity, and then you have all these osteoblasts which are trying to form new bone, right? You see the marrow spaces, they are replaced by vascularized connective tissue. And a very important feature here is the presence of reversal lines, right? So in the osteoblastic phase, the histological hallmark is the jigsaw puzzle or the mosaic pattern, right? There are repeated episodes of bone removal and formation which results in small irregularly shaped bone fragments that appear to be joined in a mosaic pattern with deeply staining hematoxophilic reversal lines. So again, even in this diagram, you can see all of these reversal lines, right? So here you have reversal lines. These are hematoxophilic reversal lines, basically indicating areas of resorption followed by deposition, right? That's it. These are called reversal lines, giving the entire picture a mosaic or a jigsaw puzzle pattern appearance. Finally, it goes on to the sclerotic phase. This is the inactive stage. The osteoblastic activity diminishes and the osteoporotic or burnt out phase predominates. Finally, the ultimate result being the new bone is disordered, poorly mineralized, lacking structural integrity. So clinically, what do you see? You see presence of fractures and weakening of the bone, all of that. Okay, so again, we studied the osteolytic phase, blastic phase, and the sclerotic phase. A final note on the treatment and prognosis. Yes, this is a chronic and slowly progressive disease, but it is seldom fatal. The asymptomatic patients, they do not require treatment, and in symptomatic individuals, indicated is anti-resorptive therapy or bisphosphonate therapy. In secondary osteoarthritis, there is pain management. The complications, they include incomplete stress fractures and deformities, degenerative joint diseases such as secondary osteoarthritis. About 1% of the pagetic bone can have a malignant transformation into osteosarcoma. Other abnormalities are cardiovascular abnormalities. And a note on dental complications, it includes difficulty in extraction of teeth. Why? Because of hypercementosis. There is a chance of osteomyelitis, and this is because of poor wound healing. One more note on the laboratory findings of Paget disease in relevance to the questions that you see. There is increased level of alkaline phosphatase, right? So markedly elevated alkaline phosphatase with normal serum calcium, phosphorus, and acid phosphatase levels. I have 3 questions for you. The most characteristic radiographic appearance of Paget disease is described as which of the following? Mosaic pattern is histologically seen in which of the following? And which of the following disease is associated with Paget's disease? I hope by now you should be able to answer all of these, and please comment in the comment section if you do. So, concluding the video, we started by talking about what is osteitis deformant in relation to BARD. It's a bone disease with abnormal resorption and deposition. The 3 phases, which were lytic, mixed, lytic and blastic, and sclerotic. Etiology, mainly genetic, inflammatory, and viral. Clinical features, where I told you about these sites, the 5 sites which were skull, femur, tibia, and lumbar vertebrae, sacrum, and pelvis, right? So if you remember 5 of these, you can easily tell all the clinical features. There were complications in treatment and prognosis, radiographic appearance of cotton wool appearance, and osteoporosis circumscripta, and histopathological features of jigsaw puzzle or mosaic pattern. Thank you so much for watching. If you liked the video, please comment, share, and subscribe. If you know the answers, do comment them. I would be really happy to see it. and I hope you have a great day ahead. I'll see you in another video. Thank you.